What's great about the surgery, in my opinion, are the stories behind some of the outcomes and some of the patients who've had great results. One of which was a young lady who came in the office and very embarrassed about her feet. And as a man, you just don't think about these things. And she was not only nervous, but a little bit weepy-eyed, and mom was there, and I could feel the stress in the room. And I just asked, what are you here for? What would you like? And how can I help you with your feet? And she went on to talk about how she thought her feet were ugly. And I had to dig the next thing out of her, which was, well, what do you mean? Was it the way your toe is curled up, or the way this bump is over here? And she just started crying. Said, I can't even go to the pool with my friends. I'm 17 and I'm about to go to college, and I'm just so embarrassed. I don't even want to wear open-toed shoes. It was moving, and by the time we actually discussed the surgery and had it scheduled, she was a little bit more confident, but more importantly, talked through everything to the point where she felt like, okay, this is going to be a new start for me. And those are the kind of things that make being a cosmetic foot surgeon fantastic. But even the aftermath with taking the stitches out and the whole visits with the family and the mom, we got to know each other. And it was also a neat feeling that when the scar tissue finally regressed and her toes did look normal, she came into the office and gave me a big hug, said just how happy she was to be able to wear sandals and go to the beach and not be embarrassed. And it's those types of things you never forget. Cosmetic foot surgery is a specialty within a specialty. And when patients come in for cosmetic foot surgery, I first ask, what do you want done? I mean, what displeases you? What is painful? Once we get through all that, I can explain to them that cosmetic foot surgery has a few areas that are the most common, that we can fix very easily, and others are just per patient. So for example, if a patient comes in for the big toe joint or bunion deformity, that's when the bump on the first big toe joint is prominent, it's pushed over and crowding the second toe, or rubbing on the shoe, or discoloring. The second type of surgery are digital surgeries, and that's everything from a long second toe, or the toes getting pushed up in the shoe, or the quintessential hammer toe or claw toe, different types of corn deformities or discolorations in the skin from rubbing or pressing on the shoe. Pain, of course. The fifth toe is another real common one besides the second toe, of pressing in against the shoe and creating the sore fifth toe on any type of slim shoe that's enclosed. Most common is the female dress shoe, or pump, if you will. And speaking of pump, there's something that we've coined the pump bump, and that is the bump on the back of the heel from rubbing on the shoe. This area back here will become raised and painful, but also discolored and not too attractive. Those are also very, very easy to fix. I remember a patient coming in one day for some ankle pain and noticed that she had some derangement of the toes in the front of her foot, and she wanted to talk about how it was swollen and bothering her with exercise. And I casually mentioned the toe that was pushed up in the air, and another problem with her big toe joint, the quintessential bunion deformity. I said, no, I just don't have the money for that. It's not hurting, but it is a little uncomfortable in shoes. And I said, it's covered by insurance. And that is one of the most common problems, I think, that I see in the office with cosmetic foot surgery. Not so much, what's going to happen and how are we going to fix this problem, but patients, first and foremost, just assume it's not covered. And these procedures are covered by insurance. Another important question that patients ask at our offices is that why? Why should they use me or our surgeons to have this procedure or procedures performed? And it's a very fair question. Personally, it's hard to say how good I am and why am I the best at these types of procedures. But to be honest, it's a serious question, and they need to know that this is all I've done. I mean, 25 years of this. No, started in one specialty and slid into this later. Foot and ankle surgery is all I've done for 25 years, and I performed thousands of the types of procedures you'll see on my website. Another important point is the board certification. Board certified with the national credentials that you would like your surgeon to have. And we keep it fresh in our practice where the students are constantly revolving through. And I've been a surgical instructor now for over 15 years at 2 residency programs here in Houston. Lastly, understanding the equipment is important. So I actually invented a bone screw back in 2000 and went ahead on to patent it with a surgical equipment company, and it's still in use today to be able to make one of the surgeries we perform go a little bit smoother and faster. We put something called dexamethasone phosphate, which is a very short-acting cortisone that basically acts like putting a bunch of Advil, right underneath the skin. And I did that around the forefoot and the digital surgery she had performed on the toes, and assured her that this would really calm things down. And after the surgery, she was elated. She came back in for her 72-hour check, which we do at our office, which check for infection, change the bandages. And she said on a 1 to 10, the first time she had a 9 or a 10 on her first surgery. And with our surgery, she was about a 1 or a 2. And ended up taking 1 or 2 pain pills and some anti-inflammatories, and virtually had no pain from that point forward. We let them know that the type of anesthesia that we use for extremity surgery is very light. I mean, they're out, which is what most people want to know. They're not going to wake up during the procedure, but it's very light. It's very safe. The procedures are always around an hour to 2 hours max, so there's not as much time under, and henceforth less complications, less difficulties waking up and feeling groggy or hungover. Lastly is the post-operative recovery. We have all of our parameters laid out unless things change, of course. You can always get into our office with text or email or phone calls if anything happens during hours or after hours. And furthermore, we prepare for anything. For example, I had a patient who probably needed a special type of walking boot because it was a surgical fracture that I was correcting. And they wanted a little bit more freedom, so we have these knee boards with wheels on it. It's kind of like a scooter, so they can get around the house easier. Wheelchairs, walkers, even a bedside commode because a patient didn't want to have to walk all the way to the bathroom. But we have covered all bases, so whatever your needs are, we can take care of the post-operative period and make sure you're comfortable. And then, of course, the rehabilitation. Some procedures don't need rehabilitation. Other procedures do, and we can coordinate work, return, lighter duty, things of that nature, and of course the forms that are for family leave, regular sick time, short-term disability, all these types of entities that have to be worked out before surgery are done by my staff. We covered pain and other types of outcome concerns that my patients have, but another high concern they have is about financing and also what's going to happen after surgery. So I'd like to talk a little bit about patient concerns on that level. Over the years, the nice thing about practicing for this long is we have a staff that takes care of everything. And of course, I oversimplify it when I'm with the patient because it's not simple, but we have. When they come into the office, their insurance is already verified. We check to see where their deductible is, what type of out-of-pocket expenses they have just for the office visit. So at least you know where you are on that level, and not all offices perform that service. Second of all, we look into the type of facility. For example, we have in-network and out-of-network facilities. I am a in-network surgeon provider, so they don't have to worry about my coverage on their insurance. And then, of course, our office submits what types of procedures, if they're going to be approved or not, so you're guaranteed that they're covered. And if you have interest or time to review these types of videos, we have our surgeries and our patient testimonials on our YouTube channel, which is MFAS Clinic, or short for More Foot and Ankle Specialists. Or you can go to our website at myfootfix.com, both of which have these videos available if you'd like to see the actual procedures or what patients have to say about them.